name is Tina Nelson. I am the Director of Quality, Patient Safety, Performance Improvement, and Infection Control at Eastern State Hospital. I'm also an EKU student. Today we're going to talk about the evaluation of prescriptive practices and management of antibiotic use in inpatient psychiatric facilities. This video will be on YouTube for you. When we talk about antibiotic stewardship programs, we know that they're well established and touted in acute care settings as being best practice. Antibiotic exposure is the single most risk factor for Clostridium difficile, and we know about the impact of morbidity and mortality through the CDC and outcomes that are outlined in their core elements of hospital and antibiotic stewardship programs. So when we looked at the literature related to antibiotic stewardship programs in behavioral health, there were two evolving themes that we wanted to investigate. One being the antibiotic stewardship program and prescriptive practice overall, and validate the overall practice. Another is the infection in the inpatient psychiatric facilities and the prevalence and if there's any literature associated with the antibiotic stewardship program. Our findings are that there is very reliable and valid data related to antibiotic stewardship programs. There is not a lot of information related to antibiotic stewardship programs in inpatient psychiatric settings, although there is a high prevalence of infection in the mentally ill population. So looking at ASPs, which is antibiotic stewardship program in behavioral health, we find there's a paucity in literature related to our severe and persistent mentally ill and the monitoring of antibiotics. And we also find that the overall evaluation of antibiotic stewardship programs and prescriptive practices of psychiatrists, in contrast to medically internal acute care setting physicians, have not been monitored at all. The impact on nursing practice is just the overall growth of multi-drug resistant organisms and how they provide care. APNs can order antibiotics and be very conservative and recognize the value of the antibiotic stewardship program, as well as understanding the symptom burden that's related to medication management in the acute inpatient setting. So we would like to recognize also that there is a difference in psychotic disorder and delirium related to infection, and APNs need to recognize those symptoms and characteristics of delirium in contrast to psychiatric disorders. For direct care staff at the bedside, there is a lot of relationship with contact isolation and its associated factors related to seclusion for inpatient psychiatric facilities. So we want to make sure that we have that clear distinction and understand the difference in monitoring for the infections at an inpatient psychiatric setting. So what we want to propose to change practice would be the evaluation of antibiotic stewardship programs in our inpatient settings with severe and persistent mentally ill patients, with the inclusion criteria being related to antibiotic stewardship program, medical necessity, ordering prescriptive practices, and the overall effectiveness of the program in behavioral health settings. Thank you.